Hi, I'm Brenna, and today I'm going to be talking about the voice facilitation technique called chewing. This is a very helpful technique for patients who experience vocal hyperfunction, which is characteristic of clenched teeth or very little jaw or lip movement. So patients who really stress to clench their teeth and get their voice out, which causes a lot of stress in the vocal cords and surrounding areas. A lot of clinicians can view this as similar to what a ventriloquist would look like. It's that patients are struggling a lot to get their voice out, to move their mouth and their teeth and their tongue and lips. So basically, these patients speak with a lot of tension in their voice. They're really trying hard, and there's a lot of stress. Usually results in a hard glottal attack. This technique called chewing while voicing is very helpful and can often result in less strain in the voice to ease up that glottal attack and overall improvement in the vocal quality of these patients. So basically how this technique is implemented is very simple. It really just surrounds making the patient aware of how they are speaking and really thinking about easing up. First step is to make your patient aware for the need of greater mouth opening while speaking. This can be done very simply by utilizing a mirror. You can hand them the mirror or have it on the table. They can view the way that they speak with that clenched jaw, and then by standing next to them in the same mirror, you can show the difference between the way that they are opening their mouth very slightly versus the way that you would open your mouth for more regular speaking and such. So it is very helpful to use a mirror to demonstrate the vertical and the horizontal movements that are utilized in this chewing technique as well. So the first step, aside from making them aware that they are clenching their teeth, is to show them how to over exaggerate their mouth movements. So like this, really loosening up the jaw and showing them in the mirror the differences between the way that you do the chewing technique, the way that you talk regularly, and the way that they talk. It is really helpful to show or to tell them to imagine they're chewing on a big wad of food, not to worry about closing their lips and letting the food fall out, so to speak, but just really chewing on something nice and big in their mouth. Once they get the general step of that over-exaggerated chewing down, you can add in a light voice. This is helpful by using mixed sounds, nonsense words, and vowels to really loosen up the jaw, not to get repetitive and to learn specific patterns, but to use the nonsense words and really just move your jaw in different ways. So you really want to keep making sure that the voice or the mouth is going up and down and side to side, which will really loosen up and relax all of their vocal structures. Now, especially with this technique, it is somewhat silly, and children usually love it, but adults may have a harder time opening up to it, or might not want to do it, might not be able to do it. So this technique isn't for everyone, and as a clinician, that's up to you to decide whether or not you should abandon it at that time, but it can be very helpful. Once your patient masters that light voicing, the nonsense syllables or words or vowels, you can incorporate words and phrases, which can advance to sentences when they're ready. So it is really just making them super aware of that over-exaggerated movement of the jaw. It's going to look silly. That's what you want it to be. Just bringing awareness to that. Having them talk like this and having them loosen everything up as if they were chewing. It is important to make sure that they speak slowly to really get their body used to that movement, and then over time you can wean out the over-exaggerated mouth movements and make it look more natural, more normal. After you integrate the words, phrases, and sentences, you can begin diminishing the exaggerated chewing. Really, you're just wanting to get them used to that pattern, really learning how to relax, and then the chewing can subside. This can be utilized by having your patient do oral reading tasks that can be videotaped and played back for feedback, and just having them practice over and over again, really thinking about the chewing aspect, maybe not so much as doing it towards the end. You can gradually wean that out as they get more comfortable with the technique, and they should keep it in mind as their technique, not so much as demonstrating it, just so that they are more aware and they've developed that awareness for the oral openness and the necessary jaw movements to facilitate the vocal relaxation and perform a normal voice. This technique is really beneficial because it's easy to implement and it doesn't really require a lot. A patient can really work on this on their own, and it has shown a lot of positive effects in reducing muscular tension dysphonia and the vocal hyperfunction. Chewing is an automatic function for most or all humans, and we are used to opening our mouth and chewing food every meal. So implementing it into a speaking task can help relieve some of that stress, that glottal attack, and improve the strain that these patients are experiencing in their voice. It's easy to recreate, and it helps them relax a little bit, gives them something to compare it to. It's very beneficial as well because it is so easy. It's something that they can do at home and really practice on their own. I hope this was helpful. Thank you very much.